The COVID-19 pandemic rages on, causing enormous human suffering and additional stress to health systems, economies and communities. Those that are already weakened by years of armed conflict are particularly vulnerable. COVID-19 is not only spreading sickness and death, it is pushing people into poverty and hunger. In some cases, it is reversing decades of development progress. As access to services and safety is curtailed, and as some leaders exploit the pandemic to adopt repressive measures, it has become even more difficult to protect the most vulnerable. This is particularly true in conflict zones where civilians were already exposed to significant risks. COVID-19 poses a major threat to refugees and internally displaced people crowded together in camps and to communities that lack sanitation and healthcare facilities. A global ceasefire would create conditions for a stronger response to the pandemic and the delivery of humanitarian aid to the most vulnerable people, and would open space for dialogue. I am encouraged by expressions of support. However, this support has not been translated into concrete action. In some cases, the pandemic may even create incentives for warring parties to press their advantage or to strike hard while international attention is focused elsewhere. Both scenarios could lead to increase in violence, and civilians always pay the price. United Nations peacekeeping operations are one of the most effective means of protecting civilians in conflict zones around the world. Our Blue Helmets are now supporting national authorities in their response to the pandemic by protecting healthcare and humanitarian workers and facilitating access to aid and prevention. Protecting civilians requires us to do much more to ensure compliance with international law and accountability for violations. We must also do more to prevent, reduce and resolve conflicts. Sustainable political solutions remain the only way to ensure that civilians are kept safe from harm